and welcome, Doctor. My name is EshikaParuchuri, and I'm a sophomore at Woodbridge Academy Magnet School in New Jersey. I appreciate you joining me in this initiative, as my primary goal is to educate adolescents globally, empowering them to build healthier lifestyles by collaborating with experienced doctors across various specializations. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Aviva Fohrer, who specializes in addiction medicine. She strives to bring compassionate quality care for substance abuse and co-occurring disorders. And for this episode, we'll be focusing on the various aspects of addiction medicine, including how substance use affects the brain and body, prevention strategies, and how teens can maintain a healthy lifestyle while avoiding addictive behaviors. And now, Dr. Aviva, can you give us a little background regarding your experience in this field?
Sure. Thank you for having me, Eshika. So my background is actually a little more non-traditional. I took time off before I even went back to school, and really came to college and then medicine years and years and years after I graduated from high school. And I think in many ways it gave me a really different perspective on being a doctor and on health and especially substance use. So my primary specialty is family medicine. Primary care, you probably went, you and your friends go to primary care doctors all the time. And it gave me a really good education in everything, a little bit of everything in healthcare. While I was doing my residency, I also had a job working in a methadone clinic with people that were opiate use disorder, and especially with young pregnant women. They were incarcerated, so they would bring these young women in from the jail to our clinic to get methadone. And I really realized I loved talking to them and really spending time hearing their stories and how did they end up in jail and pregnant and on methadone because of their history of drug use. And I graduated from my residency, and instead of being a family medicine doctor, within a year I did full-time addiction medicine and have never looked back. It's been about 18 years. I love it. I work for myself now. I'm in private practice, but originally I worked for a methadone clinic, learned a lot about that, and then decided I wanted to do more, kind of broaden my horizon and my spectrum and how I work. And that's where I got here.
That's very interesting. So you have experience in both family medicine and addiction medicine.
Yeah.
Interesting.
Mm-hmm.
Okay, so let's get into the questions. What exactly is addiction, and how does it develop in the brain?
Great question, and I love it. So we sort of know and we sort of don't know, right? There is like an actual criteria for what addiction is, but I tend to not use the criteria very strictly. The way I like to look at it is addiction can be any repetitive behavior, either with substances, which is what most of us think, but I would argue that probably many of your peers, I have 3 teenagers myself, many of your peers have an addiction to their cell phones and to social media, right? So it doesn't have to be a substance, but really you want to look at it in terms of, does it affect your everyday life? Does it affect your relationship with others? Does it have an effect on your health and well-being? Does it have an effect on your mental health? And so addiction can be any kind of repetitive behaviors, right? And some of them are okay. It's not that bad to have slight addiction to exercise, right? It's good for you. But certainly people can get to the other extreme of too much exercise, right? Where it affects even their health, right? You can do it so much that it's not good for your heart, your body wastes away. So really you want to look at it in the bigger picture of how it affects the rest of your life. What it does in your brain is really interesting. So we have lots of different parts in our brain, but really where addiction sort of starts is in the reward center of the brain. I call it the lizard brain. It's the most primitive part of your brain. It's all the way in the back. Our brains as babies develop from the back to the front. And yours isn't even developed yet because you have to be 25, 26 until your brain is completely developed, and that's in the front part of your brain. So starting from the back is the most primitive part. It's the reward center, breathing, eating, digesting, the lizard part of the brain that you don't have a lot of control over. And what happens with addiction is that part gets hijacked. right? And as our brains develop towards the front, the frontal lobe is called, what we say is it deals with the executive function. So do I want to do this? Do I not want to do this? Is this dangerous getting into a car after I had a couple of drinks? Is it not dangerous? Do I want to eat a second or third piece of cake, or do I not want to eat a second or third piece of cake? Those are all executive function where you have to weigh the bigger picture and say, yes, this is okay for me, or no, this might be dangerous. And what happens in active addiction is you literally shut the door between those two parts of your brain. So people can continue to engage in unhealthy, risky, dangerous behaviors. And that frontal lobe is not communicating, is not saying, this is probably pretty dumb. It's a pretty bad choice. So that's sort of brain development and what happens in a nutshell. And it's very complex. I've made it a lot simpler than it is, but I think it gives you a nice taste of what it is, how it happens, and where it is.
That's very interesting.
Yeah.
Why do some people develop addictions while others don't, even if they are exposed to the same substances?
Excellent question. I love that question. I don't know. There's a lot of reasons, right? So I break it down into kind of three big piles. So the first pile is genetics, right? Your family. So if you look at your family and you say, I have a strong family history of addictions, and again, it doesn't have to be substances or alcohol. It could be food. It could be gambling. It could be working. Like I have just this family history where like people get really intense about stuff, right? And work addiction can be considered addiction in some way if it comes at a cost for other things. So family history and the genetics of that is going to make you much more likely to, if exposed, to also struggle with addiction yourself. And that can also be tied in with depression and anxiety. So mental health really plays a role. So you can have parents or aunts or uncles or cousins or siblings that really struggle with mental health. That's going to put you more at risk. The next one is an environment, the environment that you grow up in. So it's not just the family and the people that you grow up with, but also the people you choose to hang out with, right? Middle school and high school is when we start kind of picking the people we want to spend time with. We want to figure out who we are, what group are we with, and constantly changing. So your environment is really going to play a role in that. If you're hanging out with kids that are in the library, that are studying, that are doing arts, that are doing other things, less likely to be exposed and less likely to develop these kind of thoughts. If you're hanging out with people that tend to party a little bit more, and I'm going to put nicotine in there too, vaping as well, because it affects the brain, right? So if you're hanging out with people that tend to experiment, use more substances, you're more likely to go down that road, right? And then the third is your own genetics, you. So not just my parents and where I came from, not just the people I spend time with, but me. So you could have a strong family history. You can hang out with people that expose you and you're exposed to a lot. But for whatever reason, you have the genetics that you really don't become addicted. The problem is we don't know, right? We don't know. Is it 33, 33, 33%? Is it 10, 10, and 80? We don't know. And so that's why I always really encourage, especially younger people, to wait. I don't think anybody should experiment with drugs. Let me just say that. But like, I know in our society, most people do, most young people do, and things that are readily available. I really encourage you to wait until your brain gets more developed, because it has a stronger impact when you're younger.
What are the long-term effects of untreated substance use disorders or any general addictive behaviors in teenagers?
You're asking such amazing questions. Lots and lots and lots. So we know for a fact, long-term effects depends on the substance, right? But long-term effects are going to affect brain development. I just mentioned that our brain develops from the back to the front, kind of stops cooking around the age 25, 26. You still can learn and grow, but that exponential growth, so it's going to blunt it. And a lot of times you might hear people say, oh, the age that you started using drugs, you sort of got stuck at that age. Not actually true, but in some ways it is. So developmentally, if you started at a very young age, you might not develop some of those emotional connections with people, develop the ability to learn and obtain information the same way as one of your friends who didn't go down the road of using substances on a regular basis or have an addiction. So that's one. We know that different substances actually have effects. So marijuana, right? Weed definitely affects your ability to have to generate new information and maintain that information. It also really affects motivation. They did an interesting study in college students that smoked marijuana, like weed, on a regular basis, and then those that didn't, and the ones that smoked weed on a regular basis still graduated from college. Overall, they made less in their salary and pursued less higher degrees than the ones that didn't. So there's this known thing. Alcohol has lots of effects, right? Not just the physical, the effects it has on your liver, kind of have on your heart, on your pancreas, but also on your brain. Not just the actual drinking, but also recovering from it, right? The next day, feeling kind of hungover, dragging, not being able to do the things you need to do. I mean, I don't really think it helps to do the doom and gloom. This is what's going to happen if you use, this is what's going to happen. But people don't always realize like how it impacts, even just how to be a good friend, you know, how to listen, how to be able to be present and in the moment is really hard when you're using substances on a regular basis.
Can you tell us about a complicated case that you have dealt with in the past with a young patient?
Sure. So I had a young client that came to me struggling with alcohol and marijuana, and depending on the state that you're in, you know, it's either recreational or medicinal. And so some states it's a lot easier to get access to it than others. I also just want to put a plug that the THC levels in weed today is very different than what it was 20 years ago. And our brains are not as evolved. You know, we have cannabinoid receptors in our brains. That's what marijuana binds to, but it's very different. And so the impact that weed today has on the brain is very different than the weed from like 20 years ago. So this young person was using marijuana on a pretty regular basis and binge drinking on a pretty regular basis. And was really struggling, right? Struggling with school, clearly very smart, two educated parents who really cared. And came to me saying, you know, and in high school came to me saying, like, I want to get a little more control over it. And I'm going to back up for a second. In substance use, there's sort of two big parties, two big kind of thoughts. One is total abstinence, which is generally a more AA kind of way of thinking of you have to stop everything, you know, total sobriety, you can't use anything. And the other one is harm reduction. And I'm a harm reduction provider, meaning if you come to me and you say I'm smoking and I'm drinking, but really alcohol is the thing I'm the most concerned about, I will still tell you we're going to work on the other stuff. I will always push you on that, but I will address what you feel is the most important and then try to reduce the harm of what you're using. So I'm a harm reduction doctor. So we talked about like what's the most important thing. And so for them, the most important thing was drinking. So, okay, we worked on the drinking. Ends up, I didn't know until much later that the parents drink in the house. They drink every day. They drink in front of the kids. And this child grew up actually, they said to me, like, I grew up, you know, 5, 6 years old, learning how to mix drinks from my parents. You know, my dad would say every night, like 5 o'clock, make me my whatever drink. And so it was so interesting to me that, you know, here is this child coming from the parents and they say, we want my kid to get better. We don't want them to drink and smoke, but look at like how what your environment is, like the messaging, even if it's not a blatant message, the messaging is, it's okay, but I'm an adult. It's not okay for you. And so really like keeping in mind that we're so impacted by those around us that might say things, but also not say things, but by their behavior really affect us. So it's complicated. What do I do about that? Call the parents in and say, hey, not for nothing. This is, you know, part of what's going on. So stay tuned. Still working with this person.
It was a very interesting case. How have treatment techniques for addiction evolved from when you first started and now?
Yeah, good question. When I first started, I mentioned that I worked in methadone. So methadone is a government regulated and state regulated treatment, meaning that you have to come to a specialized accredited methadone clinic in order to receive the medicine for opiate use disorder. It's got a lot of pros. It's got a lot of cons. When I first started, a new medicine came on the market called Suboxone. That's the brand name. It's buprenorphine. It also works for opiate use disorder, but it was the first one that was for outpatient, meaning you can come see me in my private office. I can prescribe it for you. And then you go home and I see you as frequently as I think, once a week, once a month. And so Suboxone coming onto the scene really was a game changer. It also was pretty abused, both by doctors who didn't really have the experience or education to manage it, and then by people diverting it, misusing it, and abusing it. So diversion, misuse, and abuse is a big thing, even with prescription medicine. And I do want to throw in a little plug for that, right? Like you or your friends could be prescribed something, and then you could say, hey, Adderall or Xanax or Ativan makes me feel whatever. Why don't you try one? It'll help you. And people don't really realize that's actually, I mean, really, it's being a drug dealer. Like it's diversion, because something that's prescribed for your condition at any age isn't appropriate to then give to somebody else, right? But it was diverted a lot. And so that became kind of an interesting turn. We still use it. What I really love is then it became available in an injectable form. So I can give you a shot that lasts for a month. You now have it, but you can't abuse it. You can't misuse it. You can't give it to anybody else. And more importantly, if you think about opiates, pills, heroin, any of that, where you're taking the substance on a daily basis, multiple times a day, now getting something that's injected that you don't take every day, you don't have control over, really changes your dynamic with staying sober and then understanding how to live sober. That's probably the biggest one. The other one that I'm going to put a plug, and you and I might need to talk again because that's a whole nother half-hour episode, is psychedelic medicine. That's we're working on getting legalized, and ketamine is right now the only legalized FDA-approved medicine for depression and anxiety, but we use it a lot also for substance use disorder. It's called off-label. So for me, ketamine has been a big change to help people with mental health and substance use, addiction. Other than that, not a lot. This field is not really shaken a lot with new medications. It's more therapy and integrating other modalities with the medicines that we have available.
Interesting.
Mm-hmm. Yeah.
What are the warning signs that a teen might be struggling with substance use?
Again, excellent question. So it's hard, right? It's hard. You're young, your brain's developing. It's really hard to sometimes see yourself objectively and know. So one would be like a desire to stop and trying to stop and not being able to, using a little bit more at times than you want to. So I'm going to go out and just have one drink with my friends, but then I end up having 4 or 5 drinks, but I really only wanted one. What your friends may or may not say to you. I know it can be hard sometimes to say to somebody, hey, it kind of seems like you're getting a little out of control. Lying about it, right? Hiding it, secrecy. There's a lot of shame that goes around substance use disorder. So finding that you say to your friends, oh yeah, just this or just one, and that's okay, but you're using more or you're engaging in more. And then physical things, clearly, right? Like depending on what the substance is, like weight loss, difficulty, even like interest in sex, right? Like it blunts a lot of that. So I'm just not interested in being with my partner, boyfriend, girlfriend. I'm not interested in kissing. I'm not interested in dating. This is more important to me. Like I'm giving up other things I used to do. My sports isn't as important to me, but I'm going to go home and do this. And talk to a professional. Oh my God, please talk to a professional. It's really hard to diagnose it yourself.
What lifestyle behaviors can help prevent addiction and promote long-term health?
Oh, water, water, water. My kids always joke that I say water is so important. I don't think anybody drinks enough water in our society. We drink a lot of caffeinated and high sugar, but it's the basics, the things like, your parents probably say, get good sleep. Sleep habits are incredibly important, especially again, up until the age of 25. Your brain does a lot of work and a lot of growth during sleep, staying off electronics as much as possible, especially at night. Exercising regularly, really, it does have a huge impact on mood also, but physical activity is really important. And talking, like I think it's really hard for young people today to like talk to each other and really say what's going on. It's easy when you text, but you lose a lot. And I think talking to people, find one person that you trust, and let them know what's going on. And I think if you can establish those things and really try to integrate that into your life as much as possible, it's going to help you long term.
What are 3 practices that teenagers should adopt to avoid falling into addictive behaviors?
That's a tough question. I don't know that I can actually answer that. I mean, I'm going to say it and I'm going to get eye rolls from everybody, but like, don't start, right? Like, don't experiment now when you're young. I mean, wait, your brain's developing. You have a lot more potential now than you will when you're in your mid 20s to late 20s. So that would probably be one of them. The other one is if you're going to experiment, like, not alone, make sure you're with somebody else. One of the biggest problems now is there's fake pressed pills that can have fentanyl in them. So it can look like a real pill, even if you're not, if you don't think you're taking something else, they can put fentanyl now on weed. I mean, and fentanyl only needs a tiny little bit to overdose. So I guess another good practice is like in Pennsylvania, you can get Narcan, and Narcan reverses opiate overdose. If somebody isn't having an opiate overdose, it won't hurt them. If they've used alcohol or weed and they're having a bad time, you won't hurt them by giving them Narcan. I think everybody should have it. So carry Narcan to protect yourself and others. And probably another practice is, again, like, just don't be afraid to ask, ask for help, to talk about it. That's one of the biggest things, as people have so much shame and fear about what's going to happen. I'm going to get in trouble. I'm going to get in trouble with the law, but you can't get help if nobody knows about it.
I agree with that last part you said.
Thank you.
Can energy drinks contribute to the development of addictive behaviors?
Yes. So my two favorite topics are nicotine and caffeine. I think they're the devil. There are known, overdose on energy drinks that can happen. The amount of caffeine that's in them is above and beyond, what most people can tolerate. I would say, like, I hate the word gateway. That's like from my generation, gateway drug. But like, there are things that you can misuse that can lead later. And I think nicotine and caffeine are probably the two biggest ones. They're not harmless and they don't come without consequences. So yeah, totally.
How does proper nutrition support recovery from addiction?
Yeah, well, back to what you asked me 2 questions ago, for sure. Being able to nourish your body, I mean, from your gut biome to, developing the brain is really important. And most of us tend to, not always eat the healthiest. And so being conscious of good diet, breakfast, I know it's hard, but like, putting something in your body that's like a little high protein, even if it's just peanut butter on a slice of apple, and walk out the door having something in there, they just changed our school times here. So now it's an hour later in the high schools, which is amazing. But historically, the little kids go to school the latest and the oldest kids go to school the earliest. And as far as brain development and all of that, it's the exact opposite. That is not how it should be. The older kids really should be going to school later. So making sure you have something to nourish your brain and be able to get through the day, and frequent, smaller snacks. I know that a lot of kids don't eat, and then will just like eat a lot more later. But it just affects everything. I mean, I'm a mom too, not just a doctor. So I'm going to be like, eat your breakfast, make sure you drink enough water.
Can factors like anxiety and stress make teens more vulnerable to substance use or any addictive behaviors?
Absolutely. Yeah. I mean, that's sort of been a theme that I'm tying in here, right? Like mental health and substance use, and getting help and finding someone that you can talk to. I mean, there's other doctors out there like me, and there's other people who do therapy like this, that talk to you like this. You just have to find the right person. But it could be a life-changing. And the younger you are when you start, right, talking about your anxiety, talking about depression, the better it is long term. So yeah, it's a great question.
Can things like growth spurts or puberty also contribute to increased cravings?
I don't know. That's a good question. I actually, hormonally, for sure. I mean, hormones affect us. Hormones affect our moods. Maybe does it contribute to like more impulsive behavior? Maybe it would contribute to more, more desires to like experience things, maybe. But I think our society likes to blame, well, it's because of this or it's because of that. I mean, I think there's lots of reasons, right? But a lot of it comes to being aware. I'm a big believer in like just checking in with yourself, like mindfulness, meditation, journaling, ways to really like be able to see how am I doing in real time and then look back at it because we forget. That's human nature. Is we forget that last week was a good week because the last 3 days have been so terrible. I feel like my life is terrible. If you have a way to look back, so I'm not sure that hormonally, like that's, puberty or like growth spurts play a huge role, but I'm also not an endocrinologist. So if I'm wrong, that's cool. I'm wrong.
That was a good way to put it. Have you seen a bias in the patient gender? Like, were there more addictive behaviors that attacked females more than males?
No. Yeah, it's a good question. But no, addiction sees no boundaries, no color, no socioeconomic status. I've been private practice in a nice area of Philadelphia. So I have people that come in, look like your principal or look like, they have businesses. And then I have people that look like what you'd expect them, fully tattooed, like looking like you'd expect someone who struggles with addiction looks like. And I love it. It's all the way across the board. I worked with lawyers and doctors and I've worked with lots of teenagers. So no, but there is certainly, I'm not going to lie, there is bias with substance use, period. And especially if you come from a high achieving or, high functioning family, it can be really hard to say, I struggle, and I'm struggling with this. And there's bias in primary care with pediatricians. That is a fact. It sucks.
How important is it for teens to undergo regular checkups and early preventions to avoid addiction and ensure general long-term health?
Yeah, well, it's important. It's important to follow up regularly with your pediatrician or your adolescent doctor. But I'm coming back to it's like piercing that bubble of like secrecy and shame is really important. And I recognize how incredibly hard it can be, how hard it can be to say like, I'm struggling. But that's really the best way to do it. And seeing somebody regularly, I think everybody should be in therapy. I think, all of you that went through the pandemic at whatever grade you were in is like incredibly traumatic. And it feels like it's so far behind us, but really it isn't, and I'm seeing it, the outcome of that. If you didn't have a good middle school to high school experience or, elementary school to middle school because you were, in the pandemic, or like the kids that, went from high school to college and stayed home, like every stage of life that's meaningful was really impacted, and not just, 1 year. I mean, I would argue that it was 2 to 3 years. So I think it's really important to follow up regularly and to just find one person that you can open up to,
Okay, and with that, we have concluded our first section of questions, and we will now go to our next segment, which consists of common myths about addiction medicine.
Okay. Can I pause it for a sec?
Mhm.
Okay. How much? Give me a rough idea of how long, because I know I was running late. Do you have an idea?
Maybe 5 minutes.
Oh, perfect. Okay, thank you. I figure you can cut that out. Sorry.
Yeah, no problem.
Okay, perfect.
Addiction is a choice.
Absolute, not right. It is not. Listen, you make choices about your behaviors, right? So you do choose who you spend time with, what you say yes or no to, but it really isn't a choice. And at some point, it changes your brain, like I was talking about before. So the frontal part, the executive functioning part of your brain, isn't able to even make good choices anymore. So I believe in saying, take responsibility for the choices that you make and who you hang out with and what you experiment with, but it's not a choice.
Okay. Once addicted, recovery is impossible.
Nah, another one. yeah, recovery is always possible, and it depends how you look at it. But, I would say that just walking into an office of a therapist or a doctor and starting to get help is already recovery. I mentioned that I'm harm reduction. So some of my people still see me and they're not using any other substances, but they're still smoking. So in my world, they're still addicted to something, but from the other substances, they have recovery. And I try to help them work on stopping smoking. So think of it as a continuum, a spectrum, and you're on one end of it or the other end of it. And also don't look at addiction as only substances, right? I want people to think about it could be behavioral, serial relationships. I'm always in bad relationships. I never get out of them. It can be electronics, right? My device, my phone, whatever. And clearly substances is what we're talking about, but kind of broaden your horizons and thinking about what that can look like.
Addiction is only a problem for people with certain backgrounds.
Definitely not. Like I said, it sees no boundaries. And I have worked in inner city Philadelphia, pretty rough area with, people who are mostly homeless and struggling. And then I worked in my own office here with, what would look like somebody who doesn't struggle at all. And yeah, addiction sees no boundaries at all.
Okay. And now let's move on to our final questions. Let's begin with a scenario. Let's say that an individual notices that they have started engaging in certain behaviors, like reaching for caffeine or spending excessive time on social media whenever they feel stressed or bored.
Mm-hmm.
They start noticing these small changes, like increased irritability or feeling like they need these activities to function. However, they choose to ignore these signs, thinking it's not a big deal. Is it okay to dismiss these early indicators? And what should this person do if they later feel that their behavior has become difficult to control?
Yeah. No, I think that's a great question. And that's the perfect scenario, right? Is like you start feeling like something's a little off, or I'm having a little trouble controlling this, or I just don't feel right. And that need or want to bury it and need or want to ignore it and hide it is really what perpetuates it. So I'm going to come back to the same thing I keep saying is like, find someone you can open up to, find a friend. I mean, there's helplines, there's anonymous things, but really find an adult, because kids tend to want, teenagers, young adults tend to want to turn to their peers to help them. And with all due respect, it's a wonderful thing, but also how would you know how to help them, right? You have to go to somebody who's got more experience, right? So finding somebody like that is really the key. Because statistically speaking, most people that, I don't know, let me back up. Many people who experiment do not go on to struggle with addiction. That is a fact. But there's also a percentage of people who experiment young in life and then do end up struggling with addiction. You don't know who you are, and you don't know which camp you're going to fall into.
Good advice. And what is your take on Google Doctors?
Terrible, terrible, terrible. Dr. Google is not a way to do this. Even I've done it sometimes when it's things I don't know, and it's not great. I mean, listen, I think if you're going to do it, verify your sources. TikTok is not good, right? It just isn't. Like, go on and find a valid, verified source for your information. So Johns Hopkins, one of the big universities, like get information from there. Reddit and subreddits, again, you don't know who these people are. They have a lot of information out there. Slack, like those are all places to get data, but they're not verified. You don't know who they are. And especially TikTok, please. Like, that's just not a great place to get education. So go look up from, Harvard Medical School, NCBI is the National Data Bank for that you can look up like different studies and get information. So like make sure whatever you're looking up, that it's a reputable source to get your information from.
That was a good way of putting it. Okay, so our podcast session has now concluded. I want to firstly express my gratitude for your time, insights, and contributions. And for our listeners,
nourish your habits to flourish your lifestyle.
Thank you. Don't forget to follow us on our website, healthyteens.net, and stay tuned till the next episode. Take care.